Our conversation with Dr. Jamie Martin from IUP and from the APSCUF Faculty Union at the State System of Higher Education Schools is brought to you today by Marcus & Mack, a law firm representing injured people. So she's an IUP professor. How come she's all the way across the state in Harrisburg? Let's ask her that. Good morning. How are you?
Good morning, Todd. I'm well. How are you?
Wonderful, wonderful. And it's good to have you on the air with us today. I wanted to ask you a couple of things about the new job with APSCUF. Of course, you've been high up in the APSCUF organization for a while, serving as the vice president under Dr. Ken Mash. He was a pretty good role model for you to take over as president, wasn't he?
I haven't, yes. He was a fabulous mentor, good friend, a remarkable president. So I've said repeatedly I have enormous shoes to fill in following him.
Yeah, and one of the things about it is he left you in, well, a heck of a position because it's never been anything like it is now across the state system spectrum, but across the entire world with the coronavirus and all of the uncertainty that it has created. As you took over at the beginning of this month as the president of APSCUF, I'm sure you were aware that there would be challenges, but did you really bargain for something like this?
No. I said to quite a few people I was hoping for a much more boring start to my presidency. So, clearly taking over in unprecedented times, facing the coronavirus and how that's impacted our country, our world, and a lot of different systems, including higher ed, and taking over at a time whenever we're facing the financial challenges we are as a state system, clearly is a bit overwhelming.
Yeah, I could bet, but you're able to handle that. We talked earlier this morning with Senator Joe Pittman. The Senate is taking up the state system redesign budget request during this week, maybe even as early as today. As the head of the faculty union, of course, you're not just an interested observer. This is something that the faculty union had to buy into from the beginning, is it not?
Certainly it's something we've been watching for quite some time because the redesign would obviously potentially impact faculty at the 14 universities, so it's something we've been keeping a close eye on and providing some feedback. So we are going to be interested to see what's going to be happening today as that legislation is potentially moving through the Senate.
Yeah, I would guess. Talk about that redesign for a while, if you would, because it's a whole different environment in terms of what we're reading from APSCUF and the state system than it has been in the past. And the chancellor has been very much on board with APSCUF from the very beginning. It seems, at least to an outsider. Is that the way you read it as well?
Yeah, I think the relationship we've had with the Office of the Chancellor since Dan Greenspan has taken over has been much better than it has in the past. So we, were able to successfully negotiate our last collective bargaining agreement in a much less contentious way than we had at the previous one. But that doesn't mean we agree on every aspect of the redesign, or that we always agree on every given issue that we're taking up. So we still have some concerns with the way that the process is moving. Some of the things that they're considering because of even this new legislation would talk about consolidation of schools. Initially, it even included some language about closures, which that has been removed. So we do have some concerns. We've expressed those, but we do have a much better working relationship now than we've had in the past.
As we have been thinking about and watching the state system redesign, there's been also the overall atmosphere created in the last 6 months or so by the coronavirus, and I'm sure faculty have a number of issues with the idea of getting students back on campus in the fall, and safety and security, especially safety, at the very top of that list. Would you say that?
Absolutely. We've been hearing from the colleagues from across the 14, and we're hearing the exact same kinds of concerns being expressed. And I think it probably falls into a number of different areas. One of the things that we have to grapple with are, I guess I'd call them physical plant issues that we don't have any control over. So when we think about the classroom space and how that might be configured and the cleaning protocols that might happen there, even in buildings. I was talking yesterday with a couple of colleagues, and even the things like in the building where I taught, which is Wilson Hall on the IUP campus, there's basically one way in and one way out, a set of stairs that students are going up and down at the same time, students coming into classrooms at the same time students are leaving. So those kinds of things we don't really have any control over whatsoever. Are there going to be enough masks for students, for faculty, for staff? What if the students decide they're not wearing those and are coming into the classroom? How do we deal with that? We have faculty that have pre-existing conditions or might live with somebody who has some type of condition that would make them highly susceptible to this virus or make it very dangerous if they would contract the virus. We have faculty who, talked about child care issues, like everybody else who's had to have their K through 12 children home and remotely learning. We have faculty with those kinds of concerns as well. And I think most recently, we're seeing young people with these outbreaks. There are outbreaks among young people in several states because they're not social distancing. They're congregating in areas maybe such as restaurants or bars, and they're going to be in the same age group as our students, and we don't have any control over that. So I think obviously the best approach to higher ed is to have faculty and students in the same place at the same time, but we want to make sure everybody's healthy and safe. So I've said at the Board of Governors last week that the fall 2020 is only one semester. We're going to have many more to follow, and I think until we have safe treatment and perhaps a vaccine, there are going to be lots of concerns, and I'm worried about the health and safety of our students, of our faculty, and the staff members on our campus.
Yeah. Well, I recall talking to a public school teacher a couple of years ago, right after the school year opened, and he had a cold already, and he said it happens every single year. It's like jumping into a pool of bacteria when you're jumping in with students coming in from who knows where, and they're passing around a virus, and the teachers inevitably get it. And at the beginning of the school year, in a normal year, I would guess that there are a number, especially those who are vulnerable, and especially as you just pointed out, that's something we might not have considered in the past, is you're taking this home with you. You're taking home with you all of the different environs that you met up with at school that day, and that could get into your family and really spread, and that's not a good model, is it?
No, and some of what I'm reading and I think what we're hearing is that younger people who might come into contact with this and actually develop the virus may be more likely to be asymptomatic. And obviously that's a concern because we could have students that don't even realize they have come into contact or realize that they're spreading that virus. And the classroom setting and the ability to social distance is going to be challenging. And there's some discussion about having a certain number of students in the classroom and others at their place of residence using technology to zoom into the classroom setting, or various ways to reduce the number of students in a class at a given time. And one of the things that I've argued pretty loudly is that there needs to be some truth in advertising for what the students can expect when they return to our campuses, because it's not going to look the way it did in March before spring break. So I think there are just so many elements that are merging together, but the faculty are certainly concerned and some rightfully fearful about going back into those classrooms for the reasons also that you just described, that you might be taking it home to young children or to others who might be susceptible to this particular virus, and it could be devastating if they would actually develop it.
We are talking this morning with Dr. Jamie Martin from IUP, of course, but also now the new president of APSCUF, the faculty union across the state system of higher education. I mentioned before that you've been in the administration of APSCUF for a while. Since you have taken over as president and the issues have come forth, I'm sure that you've been able to meet with colleagues from other universities, just as you have been all along. Are there new challenges that come up before you every day? Do people raise concerns for you that might be more specific to their university than to another university? I mean, it's 14 different schools all in one organization. That has to be a pretty tough mix.
Yes, I mean, there are certainly some unique concerns or obviously differences across the 14. I've had the opportunity to visit each of the 14 campuses and get to know colleagues at all So there are some things that cut across all 14 pretty equally, and the concerns about the fall semester, those are being voiced across the 14 pretty equally. It's some of the other, some universities are talking about the way the fall semester will look. Some universities, for example, colleagues at Westchester, they're in a region of the state where we've seen the most cases, and so there are concerns in that regard. But right now, that seems to be the focus. I don't know if you're talking about differences at the universities and the way, that they experienced their teaching careers, but right now, what I've been hearing since I've taken over as president really are concerns about what is happening in the fall, and they're waiting for some guidance, I think, from the state system about some of the issues that would cut across the 14.
Yeah, I think those anxieties, of course, are going to remain in place and probably past the start of the coming semester. Have you heard from your colleagues at these other schools as well about different things that they've learned and different techniques that have worked or have not worked in terms of offering classes online and through Zoom or whatever technology might be used by this professor or that? I'm sure that just as with our public schools, there are things that work and things that don't work, and if everybody is collaborating and is sharing information, that can settle on some pretty exciting things.
Yes, and that's absolutely true, and I think you bring up another good point. I can speak a little bit more specifically about what was happening at IUP this summer, for example, and I think it goes back to that pivot we had to do in March. So, we were in class. Spring break was supposed to end, and it didn't, and all of a sudden everything was being taught remotely. And that's a really difficult process because you've got all of your everything in place for how is this class going to happen face-to-face if I have small groups doing presentations, whatever the various things could be that are happening. If I have more hands-on teaching in labs, in clinicals, student teachers that were in the field. So all of that had to be re-examined very quickly, and we had to do a quick pivot. I know at IUP they put together a summer institute to look at some best practices for distance learning, and there was a lot of collaboration between faculty. The difficulty we're facing as we move into the fall is if you're thinking we're going back face-to-face, but you could have some students that are in class on one day and some are Zooming in. Now you have to develop your whole syllabus and the kinds of course requirements and activities around that model. But what happens if we get into class or into the semester about 6 weeks and all of a sudden are back in the same situation we were in March? Mm-hmm. So the other thing I'm hearing from colleagues is I feel as if I'm preparing for 3 or 4 different models.
Yeah, and
that becomes very difficult as you're trying to determine right now setting up your semester and the kinds of things you'll have students doing and trying to determine how would that look in these various different modes of delivery.
Yeah, you can plan and plan and plan, and in the end you might have to throw all the plans out and just adapt on the fly as you just did. Dr. Jamie Martin, I want to thank you so much for visiting with us today and helping to explain some of the issues and wish you the best as the president of APSCUF. You've been pretty enlightening for us here this morning.
I really appreciate you having me on and look forward to talking to you again, Todd.
We'll do it in person one day. How about that?
Yes, absolutely.
All right. Have a great day.
You do the same. Thank you.
Bye now. There's Dr. Jamie Martin from IUP, who is also the new president of APSCUF, the faculty union. APSCUF, the faculty union. APSCUF.